Choice Home Care and Hospice present Choices to Benefit the Aging with your host, Joe Urrutia.
Welcome to Choices to Benefit the Aging. I'm Joe Urrutia, Community Senior Service Coordinator for Choice Hospice and Home Health. Today's guest, we have Becky Medina. She is the owner of Becky's Consulting Services. Welcome to our program, Becky.
Thank you for having me, Joe.
Becky, who are you, and can you please give me a brief history of what is it that you provide?
Okay, I currently am providing a service through my company, which is called Becky's Consulting Services. I handle referrals from the hospitals or acute care centers or long-term care and assist in placing residents into homes, into foster homes. We provide various services, IV therapy, wound care. We do provide transportation to the doctor's visits, assist the patient with the medication management, diabetic teaching, depending on the diagnosis of the patient. We pretty much put everything in, encompass in one package, so they'll be ready to be discharged or placed somewhere long term. It just depends on the situation.
So if a family member has a caregiver has a loved one that's in the hospital, they can always call you and go over the case scenario. My loved one is at the hospital, at so-and-so hospital. What is it that you can provide upon hospital discharge? Yes,
I do pre-referrals, so I just go and assess the patient myself, and then I get a basic history from with the permission of the family, of course. And then I'm able to put together a service plan to accommodate whatever needs they have, and then I triage with the social worker. And then that's if the patient needs hospital bed, wheelchair, stuff like durable equipment, stuff like that. So everything's there in the home before the patient is transferred.
And I'm sure that with caregivers, since you've been working with families and caregivers out there, it's a big difference when you can come in and ease the tension there and not so much that, and also the coordination of care. Is that correct?
That's most definitely correct, because the residents are afraid because they don't know where they're going. The family doesn't know who they're going to. So we're able to meet and bond with the family before they go home and make sure that they understand what's going to be happening. And then we also want the family to participate in the care of the discharge process also. So that does cut down, it does cut down the anxiety. The
anxiety and the stress behind that. Can you give me an experience case scenario where you've had a client that you worked through, they went through the process with your business through this consulting service?
Okay, for HIPAA regulations, I can't mention the name, but I can say patient X. Patient X was at hospital Z, and it was when it snowed, so it's been a little while. And the family was looking for placement. It was the weekend, and this family member happened to have a mutual friend of mine that works in the court regarding the guardianships and the probate court. So they gave him my number, and she called me, and I went down there the same day and talked to her, met her father, who was the man that we were going to be placing. And I was able to successfully arrange everything so he could go home the following day, because I have also resources that have the durable equipment, all that, and they know me, from experience working with them before. So the transition is a lot smoother when you have the correct resources. Then everything was provided, and the patient had a smooth transition to the foster home. And I still have him in my home, and he is doing well. He had it was a very difficult wound management care, but the wound has been resolved. The patient is doing well, and everybody's happy.
Is there an age group that you provide, or this is kind of open?
I do not take pediatric patients, but 18 and above, yes.
Okay. Is there a cost for this service?
The cost is based on what the family can afford. My company deals strictly with, like, if they get like a supplemental income, or if they get a retirement or some type of income. I work out an agreement with the family and make sure that the patient does understand and agree to it. And then we come to an understanding and come to agreement, and then we're...
So this is case by case?
Yes, every case is totally different, yes.
How about if a family member says at this point, I want my loved one to go into an assisted living, foster home, nursing home placement. Can you help him in that process too?
Most definitely. They don't have to necessarily come with me, but I can definitely point them in the right direction. If I can't help them directly, I can send them to somebody that will and can handle them. Help them, for the appropriate whatever they need.
Because there is many foster homes out there, and
yes.
I visited some, and then I visited others, and looking at what's out there in the community, I've noticed that there's some foster homes that are pretty equipped to handle a disabled person, and the bathrooms are also disabledly designed for those type of clients. So do you have a list of providers out there for foster homes that you can give them information on? Or?
I can give them the names of the owners of the foster homes,
Okay.
and then they can go out there and they can see whichever home they prefer. We usually give them like 3 to 4, and they have some to choose from.
Will you instruct them at that point at what to see in an assisted living or in a nursing home? Are you educating them about how these facilities work? Because if you look at foster home, you have assisted living and you have independent living. Mm-hmm. If a family member wants to know a little bit more, do you educate them about those different?
Yes, we have to explain the criteria to them, because every location is different. Assisted living is different from foster care. Foster care is more, it's not as regulatory as a long-term care facility or independent living. And like I said, whatever their needs are, after I do their assessment, then I'll be able to better assess what they need and which facility would be more appropriate for them, and then let the family decide. And then there's other options, like if they want to go to long care, we give them like 3 or 4 of the long care on whichever area of town. It just all depends. Like I said, every case is different.
What does your company represent?
It represents ethical practices and respecting the elderly, the disabled, and the ill. I have recently retired from nursing. I was a licensed vocational nurse for over 30 years, and I worked in all the hospitals here in El Paso. They gave me a very good foundation. And my instructor from UTEP told me the patient always comes first. And so I've got the tools now to put together my company and be able to be a more positive impact, I feel personally, than in the hospital. The hospital, well, I mean, 30 years, it was time for a change. So I chose to go into assisting the elderly, and I'm a very big advocate for the elderly, and especially for their rights. So that is one thing that it's a strong foundation. I've been to homes also that need some improvement. But if we don't educate the public, we don't educate the family, then, we're not going to know. And that's what my company and myself want to do, is educate the community, the family, and the patients of what their rights are and what's out there for them, the available resources.
Again, the name of the company is
Becky's Consulting Services.
And the number?
The number is 412-1843.
1843. 412-1843, correct.
Mm-hmm.
Becky, what and why do you continue to do this? And is this something that you just want to help the public, or do you have a passion for this? What has driven you to this type of service, helping the senior?
It's both, really. I enjoy taking care of the elderly, and it's not just the elderly, it's the disabled or anyone that's ill and that's in need of help. Homeless, it doesn't matter. I mean, we're in our society, times are getting very tough right now, so we have to help each other. It's not about money, believe me. It's not about money. It's about helping each other and helping them transition to difficult times. Mm-hmm. So when they're placed somewhere, they're going to be comfortable there, because they're going to be alone. The family's going to feel guilty. There's a lot of negative connotations with foster homes, and that's because of some things that have come up from foster homes that have not followed the rules and they don't have a passion for it. I love taking care of the elderly. My patients that I have in my house, they're like my family. I'm their surrogate mom, I guess.
And you also have a foster home, correct?
I have 2.
Two foster homes?
Mm-hmm.
Okay.
I have 2. And they're all going to be watching, because I told them, and they said, well, I said, no. I said, y'all just watch, okay? And learn, you know what I mean? Because we're all learning, but we have to respect them, treat them with dignity, and also show them that they have rights. It's all about power is knowledge, okay? And if you don't teach them, they're not going to know what they can do. You want them to be involved in their care. You want them to know what's going on when they go to the doctor. And when things like that, that's what the provider is supposed to be explaining to them. You're on this medication because of this, and we went to the doctor because of this. You're going to sign this paper, what is this? Because of this, and that way they become more involved and they're just not stagnant and ignored. because that's not right. I mean, we need to respect them. They've been here for a
Respect
while.
their choices too.
Yes, exactly.
And that this benefit, their Medicare benefit, is their benefit. They can choose a home health agency,
That's
a
exactly right.
hospice. They can choose a nursing home. Even physicians. Is that correct?
Yes, you can choose their own physicians. They can't choose their medicines, but they can choose their own doctors. Some of them try that, but you got to talk with them.
But it is because through their Medicare benefit,
Yes,
it's theirs.
That is correct.
Becky, what message do you want to convey to the public about your services?
I want the public to understand that I want to change the image that people have of foster homes. And I'm speaking specifically for mine because I can't speak for somebody else, that there are places that are very good that you can recover and live a good qualified life. And it's not about money, and that I do want to emphasize, okay? It is about taking care of an individual that's in need and them becoming part of your family. And that's what I love. I like to see them come from a very deteriorated state to this flower. They're like a plant. If you water them, they're going to grow. And if you don't, they're going to just stay stagnant. And the group of residents I have, I'm very blessed. They have really, to see the improvement and the discharge, that's very, very gratifying for me. And that's why I do it.
So these are two businesses that you operate, which is the consulting services, and then you have the foster home, correct? Okay.
Two. I have two foster homes.
Where are they located?
They're located on the west side. One is at 705 Dorsey, and then the other one is at 1117 Sun Shadow on the west side also.
Both of them on the west side?
Yes.
Okay. Do you invite the public to, if they want to visit your facilities, they're more than welcome?
They can come and look at the facility, yes, but as far as the residents, I may want to put the residents in the room or ask them permission because we have to respect their privacy. So, they're in charge. They say, yeah, then it's okay. If not, then they can go in their room where, have their own privacy. You have to...
So this is their home?
Yes, that's exactly right.
This is their home,
That's
so you have
exactly
to respect that. When are you available?
8 to 5, and if after 5, leave a message, and I will get back to you the next day. Or email, have the email. I don't know if you were going to post it on the screen.
On the screen, what is your email?
Rebecca.Medina.
Medina.
Medina.Rebecca17@yahoo.com.
Again, it's medina.rebecca17@yahoo.com. So they can contact you also by your cell phone, and can you give me that phone also?
Yes, area code 915-412-1843.
Who is your target audience with Becky's consulting services?
The ill, the elderly, and the disabled. And if the family, in general has a family member that it applies to, they're also included because they're part of the group of, they're part of the dynamics involving what the patient needs or resident needs.
So you integrate the caregivers also, and that's a very important process that you integrate them. As far as the services again that you provide, can you please go over those
The
scope of
services I
services?
provide are, I do free assessments. If the hospital calls me to go see a resident or possible resident, I'll go to the hospital, assess them, and see if they meet my criteria. What is the situation? What are their needs? Based on that, then we talk to the family. Some of these patients have legal guardians. Some of them have power of attorneys. So we have to know who's in charge. Or sometimes there's nobody, and it's just a patient that's really in need. So I will go do the referrals, assist with the placement, order whatever durable equipment they need. I will be, transportation is provided by doctor to the doctor's appointments. If they need lab work drawn, that is provided. Medications are also provided. It depends on the situation of the patient. If the patient doesn't have the money, I'll buy the medicines. But if they do have the money, then, it's just going to depend, like I said, and then keeping the family informed of what's going on with the resident, also giving them a report, like when we go to the doctor. What did the doctor say? What did he order about? And, stuff like that is what we're going to, keep it, so the family keeps informed too, because a lot of them work. They're not able to go to the doctors with them, but they want to know what's going on. So, that's it. And my experience as a nurse being retired as it is, I have a lot of knowledge. I know a lot of physicians, and it's easier for me to get to a doctor because a lot of families will call and they can't get past the receptionist. So I get a quicker response if anything's needed for the patient too. So that's an added plus.
Okay, we talked about the hospital referral, and again, I want to go back to the public. If a family member has themselves situation at home with their loved one, they can still call you.
They can still call me. They don't have to be in the hospital to call me. They can call me. Again, my number is 915-412-1843, and I will go out to wherever they're at, and I will see what I can do to help them.
Okay. You have here, I'm looking at your business card, and it says also you do vents and trachs are welcome.
Yes.
And that is through your foster home,
Yes.
correct?
Yes.
And there's very few foster homes, Becky, that really provide the vents and trachs, and you being a nurse.
Right, that's it.
And I've known you for many years. You've worked in intensive care units, pediatric intensive care units, and those are pretty intense right there alone. And just so again, this is pretty interesting to see that you have that on your business card. Home inspections, tell me a little bit about that. You say
if someone calls me that would like to maybe possibly even start their own foster home, they can call me and I will go inspect the home and let them know what they need to do as far as making changes. Making changes of what? Well, for the health inspector, the fire marshal, the windows have to be a certain dimension. The bathroom widths have to be a certain dimension. The doors have to be a certain dimension. The rooms, depending on the occupancy, have to be a certain dimension. There's a lot of things, but we don't have that much time. But I could give them an idea that if they want to go into this type of service, that there's going to be a lot of things that have to be adhered to before even inspection, because you have to have 3 inspections after you have the house set up. And there's a lot of things that have to be done. So it's pretty structured, the foster home setting, what the city requires.
How long has Becky's Consulting Services been in operation, and going into your foster home, how much experience do you have in foster home living?
In foster home living, it's about 5 years.
5 years? Okay.
My company just started, it actually started 3 years ago, but I just barely started getting enough clientele this year, and that's when I went ahead and applied with the city for my license for Becky's Consulting Services. But it's kind of like, it was a little experiment, and I really, really enjoyed it, and it's growing. So I feel like I can make a positive effect on the community here.
One client at a time,
That's
one
right.
caregiver.
One phone call at a time.
One phone call at a time. Becky, we've known each other for maybe 20 years or more, and I worked with you when it was in pediatric intensive care. And then you've moved on from pediatrics to adult care, and you're pretty well holistically rounded. And one of the questions what is it that motivates you?
It's the improvement of the patient.
The outcome?
The outcome, the result. The result of everybody pitching in together, like the one client that we talked about earlier. That man was very, very ill, but through the effort of a lot of people, he's like, it's just amazing on the improvement. And the daughter wanted me to say that if anybody wanted to hear her story, to please email me, and I would give you her number so she can tell you about this story. If anyone's interested, she would love to tell her story, because her dad is really doing really well. So basically,
through Becky's Consulting Services, you're just bringing all the appropriate clinicians.
That's right.
Medical equipment companies and other providers out there, medical providers, to make it easy.
Right. You have the doctors, you have
bringing them all together.
The nutrition, not the nutritionalist, but you have to make sure that they're eating, that they're actually taken care of, period. Your basic ADLs, bathing, cleaning, brushing their teeth, brushing their hair, communicating with them, let them know what's going on. They have to be stimulated, or they're, like I said, it's like a flower. If you don't water it, he's going to stay withered. But it's the results that really drives me to just continue doing this, because I enjoy it tremendously.
The statistics show that it's, what is it, like 10,000 seniors are turning age 50 per day. And it's kind of an alarming, the population of seniors out there. And you and I talked about this last time over lunch, and how this can become a crisis in a way that, like you were saying, that there's going to be some abuse, elder abuse out there, and how the public needs to be informed of taking care of our seniors out there.
And our seniors have rights. They have rights that have to be acknowledged, because we have to be the advocate for the patients that cannot speak. And that's my foundation. I learned that since I graduated in 1976. It's just, and it's the right thing to do. Ethically, it's nothing to think about. You just do it. And that's how I am, and that's why I feel like I can really make a difference.
Basically, do unto others as you have them do unto you. And if you follow that rule, you're always going to do the right thing
And also,
for
you know,
the patient, client.
if you treat the patient as if you're your family, your own family, that puts a different spin on it too, because it's a learning process. We sometimes people lack the experience, you know, and that's where I hope to make a difference to help people maybe groom themselves a little bit or make improvements on their home, make improvements on the care of the patient. But if anyone is in a position where they think that something's not right, please call me. I will definitely help.
Becky, I'm going to ask you a question. It's something I always kind of bring it up in the program, and it's the word denial, and denial through a disease. You've been newly diagnosed with diabetes. You've been newly diagnosed with life-threatening disease, and most of the diseases, and most of them all, can be treatable, manageable, not treatable, but managed, correct?
Yes.
How do you agree with me that denial is just a coping, and it's really a coping mechanism? That is just education, and once you educate the client about the disease process and tell them, okay, you're diabetic, and these are the things that you need to do to keep you healthy by taking your medication, what else? Exercise, eating appropriately, sleeping well, and the plan of care that goes along with it. Do you think that that is a key to removing the denial through education?
Well, you can't remove denial, but I mean, I understand what you're saying, and I do agree. The patient, whoever's been given the news, negative news, needs time first to absorb it, and everyone's different. And then once they absorb it, then you come back to them when they're more receptive time, because if you just told them that, might as well stop, because they're going to just shut down because they need to absorb it. Meet with them a later time and then say, you know what, let me explain to you what diabetes is. This is your lab work. This is your hemoglobin A1C that's out the roof. This is the normal, this is yours. Let's look at your weight. This is the normal weight, this is your weight. Let's look at your eating styles. How about those hamburgers and cheeseburgers and all those Cokes? Okay? But all of this can be improved where you can get your weight down, you can get your sugar down, and you can't cure diabetes, but you can manage it. So I mean, it's what it's doing is it's making them learn that they have to adjust to a healthy lifestyle. That's all that is. They can stay in denial, but you know, if you get them to exercise, they're going to start feeling better. And then as they, in their own terms, then they will hopefully gradually come around to saying, you know what, I need to take care of myself so I don't have such a bad case of diabetes.
And you kind of explained it very well. I was reading a book by Elizabeth Kubler-Ross, who's the guru of death and dying, and every clinician has read that. It's a must book to read. And her second book, she wrote it, and it had to do on grieving. And she explained about denial. It is a coping mechanism, and you cannot take away until, like you said right now, till a person comes to terms with it, and then they can move to the next step level. Through the next level through, you know, now I want to take charge of, not let the disease control me. I will control the disease.
You empower them. Empower them, yes.
I will control it.
Yes.
So,
through knowledge, you can do that. It depends on how receptive they want to be.
and I kind of see you in that sense where you're coming in, where sometimes the family is also in denial, you know, and you're finding that you're saying, okay, I'm here, okay, let's help now. Let me help you navigate you through the appropriate resources, through education, placements.
It's important that they trust you. Once you have the trust, then they let the guard down, you know, but it's something new, and fear is normal because it's the unknown. So it's just gaining their trust, explaining everything to them, taking your time, say, you know, then come back later. It doesn't have to be right now. I'll come back later, come back next week. It depends on what the situation is with the time.
So right now I'm going to say if there's a family, if you have a family member out there in a hospital and you want to know more about what there's out there in the community for your loved one, they can always contact you at Becky's Consulting Services.
Yes.
Your number again, Becky?
915-412-1843.
Okay, and not only in the hospital setting, but if they're in a situation at home where it's just, the care is just becoming more a burden, not so much a burden, but I think complicated.
Overwhelmed.
And overwhelming. That's where you can come in and also connect them to other appropriate resources.
Most definitely, or if anyone thinks that they're in an abusive environment, please call me. Please call me, because we can't ignore this. It's too big of a problem, and I think with everybody getting involved, we can maybe cut down on some of those odds.
And the regs are out there, federal regulations are out there
Oh,
to
yes.
really protect, the laws are protecting our seniors, and I think more so than ever that, 'cause I think we'll projecting to see some elder abuse in the future, and I'm sure you've seen some, I've seen
Yes.
some cases myself in the past.
And there are other resources out there to call that will come in and investigate that. You know, it's all working as a team. I was just a couple of weeks ago there was a convention with the rights of the elderly and abuse of the elderly, and it was very, very informative. It's very, very. And it's
What did
every year.
you what did you gather from this?
All the resources that are available. I was only as far as my own view was Adult Protective Services, the State Ombudsman, but there's a lot of other resources that are out there that are available.
Well, Becky, I want to thank you for joining us today on Choices to Benefit the Aging.
Thank you for having me.
And if you have any questions, I ask this to the public, you can always contact Becky's Consulting Services. Again, if you need some foster home placement to assisted living. Also, if your loved one, again, like you said, they're in the hospital and you need some assistance with coordination of care, Becky's there to help you.
Most definitely.
Foster home placement, she also has a foster home business. Two foster homes on the west side. Please contact her. And her cell number is 412-1843. Thank you, Becky.
Thank you.
God
Thanks
bless
for
you.
having me.
I want to thank the public for joining us today on Choices to Benefit the Aging. If you have any questions about community services, such as, again, assisted living, foster home placement, you may also call me, and I will work in conjunction with Becky in the future. If you have any question about your Medicare home care benefit or hospice, what is hospice, you may always call me on my cell phone, which is area code 915-588-8382. Again,
Excuse me, and also if they want a copy of their rights.
the
I
Bill
can-
of Rights. Oh, you have the.
Yes.
They can.
Yeah, they can
The
contact
Residence
me
Bill of
and I will
Rights.
mail it to them, email or fax it to them.
And this
For
is
free.
provided to the Bill of Rights. Who is this? A state?
That
Or
is,
federal?
this one is just a generic form stating, it has some state agencies here that are affiliated with this, but it's just saying what their rights are in general, you know.
Let me see this, Becky. And one of them would be not to be physically or mentally abused or exploited, to be treated with respect, consideration and recognition. So if anybody needs this Resident Bill of Rights, you may contact Becky's Consultant Services. Thank you again for watching us on Choices to Benefit the Aging. God bless you.
Choices to Benefit the Aging has been brought to you by Choice Home Care and Hospice. For more information on this program, go to El Paso Southwest Senior Magazine at www.southwestsenior.com. Furniture provided by Copenhagen, 65